Okay, so have you ever gotten a prescription refilled and you see the milligrams are different on the new bottle and you think, hold on, did my doctor accidentally give me like something weaker? I swear this happened to me with allergy meds last month and it totally threw me for a loop.
You're not alone. It's so common to think a higher milligram means a stronger medication.
Right, like bigger number equals bigger punch.
Yep.
But that's not always the case with medications, and that's what we're diving into today, why milligrams don't necessarily tell the whole story when it comes to how potent a drug actually is.
Exactly. And you've handed us this really interesting article, and it starts with this story about a patient, Mrs. Mary, and she was convinced her new blood pressure medication was less effective because it came in a lower milligram dosage, even though her doctor was like, no, this is the right choice. Yeah.
Oh, I can totally relate to Mrs. Mary. But then that begs the question, if it's not about the milligrams, what is it about? What makes one medication like stronger than another?
So the key is understanding the difference between dosage, which is simply the amount you take, and then potency, which is the inherent strength of the drug molecule itself.
Okay, so it's less about the size of the dose and more about the power of the ingredient itself.
Think of it like this. A tiny drop of poison can be way more potent than a huge amount of something that's completely harmless.
Okay, that makes sense. It's like comparing a dab of super spicy hot sauce to like a whole bowl of mild salsa. You need a lot less of one to feel the heat.
Exactly. It's not about how much you consume, but the inherent power packed into that tiny amount. And when it comes to medication, pharmaceutical companies, they spend years researching and designing their drugs to be effective at the lowest dose possible, minimizing the potential risks.
So like 5 milligrams of one medication could actually have a stronger effect than, say, 50 milligrams of another.
Absolutely. It might sound kind of counterintuitive, but a smaller dose can sometimes be more potent depending on the drug molecule itself. And this is where it gets really interesting because on top of that, each person responds to those molecules differently.
Okay, so the strength we perceive isn't just about the pill size, but also how like our individual bodies react to it.
Precisely. And there's no one-size-fits-all answer, right?
Yeah.
Because factors like your metabolism, your genetics, even your age and lifestyle can influence how your body processes medication.
That makes sense. It's like how some people can handle spicy food like a champ while others are reaching for a glass of milk after like just one bite. We each have our own tolerance levels.
Exactly. And that's why it's so crucial to have open communication with your doctor. They take all these individual factors into account when determining the right dosage for you.
It's like finding the perfect puzzle piece, not just grabbing any old shape from the box. And this is where those follow-up appointments become so important, right? Because it's not always like a one-and-done situation.
Absolutely.
Yeah.
Your doctor might start you on a certain dosage and then adjust it based on how your body responds. It's about finding that sweet spot that's effective, but also safe and manageable for you.
So if my doctor changes my prescription and the new one has a lower milligram, I shouldn't just automatically assume it's weaker.
Exactly. Don't get hung up on the milligrams alone. Trust your doctor's judgment and talk to them if you have any concerns. And speaking of things we should talk to our doctors about, this article also gives us some really practical tips for making sure we're getting the most out of our medications. Are you ready for those?
Hit me with them. I am all about actionable advice.
Well, we've covered a big one already. Don't fixate on the milligrams. A lower milligram pill isn't automatically less effective.
Right, just like those deceptively tiny but mighty hot peppers.
Now, this one might seem obvious, but it's worth repeating. Always follow your doctor's instructions when taking your medication.
Got it. Take as prescribed, don't play doctor at home. What else?
Ask questions. If you're unsure about something, or if you would prefer taking your medication in a particular way, just ask your doctor. There might be alternative options available. For instance, if you need to split a pill to make it easier to swallow, double check with your doctor or pharmacist first.
Makes sense. I've always wondered about that. Can you just split any pill?
That's a great question. Not all pills are designed to be split. Some medications are designed for slow release, and splitting them could interfere with how your body absorbs the medication.
Oh, wow. So it's always better to err on the side of caution and ask.
Absolutely.
Huh.
And while we're on the topic of being careful, proper medication storage is crucial. It's easy to overlook, but factors like heat, light, even humidity can affect how well your medication works.
You're kidding. So storing my pills in a humid bathroom cabinet is probably a bad idea.
You got it. Aim for a cool, dry place, ideally in their original containers, to shield them from light and moisture.
Good to know. Now, this one might seem like a no-brainer, but the article emphasizes the importance of telling your doctor about all the medications, vitamins, and supplements you're taking.
That's such a critical point. Even seemingly harmless things like herbal supplements can interact with certain medications. Full transparency with your doctor is key.
It's like giving them all the puzzle pieces so they can see the full picture.
Right, exactly. And speaking of puzzles, there's one more tip I found interesting. It's about liquid medications. Always remember to shake those syrups and suspensions before taking them.
But seriously, I'll be honest, I don't always shake those.
Yeah. It's one of those things that's easy to forget. But those medications are formulated in a way that often requires shaking to make sure the active ingredients are evenly distributed. If you don't, you might not be getting the full intended dose.
Wow, you live and learn. I'm definitely going to be more mindful about shaking things up from now on.
It's a simple step, but it can make a world of difference.
So to sum up our medication wisdom, don't fixate on the milligrams, trust your doctor, speak up if you have questions, store your meds properly, tell your doc about everything you're taking, and shake, shake, shake those liquids.
Well summarized, this is really about being informed and proactive when it comes to our health.
Yeah, it makes you realize we have more control than we think. I mean, we don't want to self-diagnose or anything, but being involved and asking the right questions can make a real difference.
Absolutely. Feeling empowered to understand and manage our own health journeys is key. And that starts with knowledge, what we've been talking about.
I'm feeling a lot more confident about having those conversations with my doctor now. No more milligram mysteries for me.
That's what we like to hear. And that brings us to, I think, a really important point from this article. It really stresses how important that open communication with your doctor is.
It's a partnership, not a dictatorship.
Well said. So here's something to think about before your next checkup. What questions are you going to ask your doctor to make sure you're getting the most out of your medications?
Ooh, that is a fantastic question to ponder. I love that. It's like a little challenge for our listeners.
Right. Think of it as a way to jumpstart that conversation with your healthcare provider and really advocate for your own well-being.
Because knowledge is power. And feeling empowered in your own health journey. Priceless. Thanks for diving into this with me today. Until next time, keep those questions coming and stay curious.